Hi, I'm Marwa Abdinor.
I'm Amy.
Hi, I'm Savannah.
Hi, my name is Sandhya.
And we would like to welcome you to Oahu Optometry and Optometric Business.
Oahu Optometry is located in downtown Honolulu, making us easily accessible as we are located in the center of the island. We plan to extend our services to those who don't have insurance by hosting a monthly charity event. At these events, we'll offer a free pair of eyeglasses to those in need who don't have insurance. We will promote and advertise our business through distributing informational brochures to health centers that work under the Hawaii Medical Services Association. Additionally, 1 week before our monthly charity event, we will broadcast a 1-minute commercial to inform the community of our services and upcoming event. Our last form of promotion is through Twitter, Facebook, and Instagram, where we can freely display our office, service, and work without breaking HIPAA. We plan on employing 8 employees upon opening, who each are eligible for a raise after 5 years of employment. We plan on associating our practice with Vision to Learn, Eye Care Hawaii, and Downtown Vision. We plan on framing our business through the continuous quality improvement model. Moving on to need and success, there is a great need of optometric service due to the increased use of technology, which brings greater instances of eye disease. We have established an environment which is warm, welcoming, and open to everyone. Our target group are people between 20 to 65 plus years of age who present a greater need for care. Our associations and promotions allow us to connect with more patients. Statistics. Promotion will cost approximately $5,100. Rent will cost approximately $35,000 a year. Opening our office will cost $350,000. A loan we have obtained gave us $200,000, and the owner paid the remainder $150,000. Loan payment will happen over 5 years with a 9% interest rate. As a result, we pay $52,000 a year. We will acquire profit through the sale of glasses and contact lenses and reimbursement from insurance companies. Total profit equals $2 million a year. A share will go to the owner, a share will go to employees eligible for a raise, and a share will go to donations like the monthly charity event. Principles. We are a sole proprietorship owned by one optometrist. This is most optimal for us since we are a new and upcoming business. Services we have to offer are routine eye exams, contact lens fitting, specialty testing for eye disorders, and emergency treatment and referrals for surgery. Our office will sell prescription eyewear such as glasses and sunglasses and contact lenses. All managerial decisions will be made by the leading optometrist, who's the owner. All medically based decisions in relation to our patients will be made by the optometrist working that specific case. Our mission is to offer comprehensive eye care to ensure patients in Oahu, Hawaii are receiving optimal health results. In addition, we plan on participating in monthly charity events to raise money for the underserved communities in Oahu. Another way we hope to acquire money for this community is by applying for grants. Further, the money will go towards providing free glasses to those presenting a great need for them. By improving vision, we strive to improve the quality of our patients' lives. Goals: to provide eye care services to the Oahu community, provide eye care options and alternatives for the underserved populations in Oahu, and we expect to see roughly 21 patients per day, 100 per week, 400 per month, and 4,800 patients per year. 8 employees will be employed at our office upon opening. We strive to safeguard patient medical records, and we ensure past medical records can be easily obtained from practices outside of our own. We will work with all major insurance companies with a minimum copay of $15. We will send out 1,000 brochures to health centers that work directly under Hawaii Medical Services Association prior to opening. We will send out more if this method of promotion proves to be effective. 200 nonprofit glasses will be donated upon opening, and employees can anticipate a raise after 5 years of employment.
Here are our hours of operation. This totals a 40-hour work week. We're closed on Mondays but open late on Wednesdays and Thursdays, as well as half days on Saturdays. This can give patients who work weekdays more flexibility in scheduling.
As you can see here, this is our organizational structure with one optometrist having sole ownership of the business.
Positions in purple are the 4 staff members needed to open for year 1, and the positions in blue are anticipated future hiring. They're going to be hired in year 2. I'm just going to go through the job descriptions quickly, but feel free to pause the video to read them. The optometrist, who is also the owner, is the doctor with a professional degree who will diagnose and treat patients. They write out prescriptions and recommend treatments. The opticians must have an associate's degree in optometry. They recommend frames, cut lenses, and do adjustments. The office manager takes care of the business side and oversees the front desk technicians and the intern. They manage accounts receivable through various insurances and also accounts payable with employee salaries. The front desk technicians must have good customer service. They do a lot of patient interactions, including answering phones, scheduling appointments, and performing basic machine testing with autorefractors and non-contact tonometers. Upon establishment of the business, an unpaid internship can be created as an opportunity for a student interested in the field of optometry. The intern can assist the technicians and is overseen by the office manager. This is actually a position I had in high school, and I got exposure to working with patients and the opportunity to shadow an optometrist. Here's our 5-year plan for staffing. As you can see, we're planning on hiring 3 new paid positions in year 2, which will help us grow our business. The Hawaii minimum wage is $10.10. Our wages are competitive for their educational requirements, and there is also opportunity for growth in the future, as you can see here over 5 years. We will also provide benefits to full-time employees, including health and dental insurance plans, free vision care in office, retirement plans, technical training, as well as 2 weeks paid time off. Savannah and Sonia are going to talk more about money, but we have 2 main sources of revenue. The first is providing vision exam services, including comprehensive eye exams, refraction, contact lens exams, fittings, and trainings, as well as special testing, for example, for glaucoma or for macular degeneration. The second source of revenue is selling hardware, including frames, lenses, contact lenses, prescription and non-prescription sunglasses for those sunny Hawaiian days, and contact lens solution. These figures are estimates only, as different insurances have different reimbursement rates. In addition, we may sell more or less hardware, so that could also alter the amount of money we make.
So now we're going to talk about marketing. So vision care will always be an essential service. As any other medical practice, people will always need glasses and contacts. So in that sense, there will always be a need for optometry practices, and things of the sort. We pride ourselves on our high standard of care and want to make sure that every patient's experience is as good as we can make it, with the most up-to-date technology and information and everything like that. Also, in this day and age, there's a lot greater use of technology and screen time, therefore a greater instance of eye issues. And we also want to service the less fortunate and take care of that need in our monthly charity events, which will provide relief and a free pair of eyeglasses for each, for anyone that comes and can't afford to have a visit or anything like that. So our target group is anyone in need of vision care in the Oahu area. The typical range is between 20 and 65 years old. Obviously, the majority is elderly because, vision declines as we get older, sadly. And we also will accept insured and uninsured patients. We also aim to collaborate with Vision to Learn, Eye Care Hawaii, and Downtown Vision as part of the Hawaii Medical Services Association to, create a better network for referrals, and all of that good stuff. We also are going to hold seminars 2 times a year with this network just to ensure that we're all staying up to the standard of care that we expect, and just any new practices and things like that. So to be specific, our service ranges from comprehensive eye exams, refractions, your typical glasses and contacts, any testing, really anything the patient needs, we will cater to. Here you can see all the specific prices for every service and product we provide. on the whole, it's just more expensive for a new patient rather than an already established patient. And for all major insurance companies, it's just going to be a copay of $15. And also, we accept Medicare and Medicaid. We intend to promote Oahu Optometry through brochures at our network of hospitals and practices in the area. We're also going to have a local commercial in the week prior to our charity events and free promotion through social media pages like Instagram, Twitter, things like that. And the exact location is 1164 Bishop Street, Honolulu, Hawaii. And it's very close to Downtown Vision and Eye Care Hawaii, actually on the same street. So we're very close to our referral sites and places in our network. So it's an ideal location in central Honolulu.
Hi everyone, my name is Sandhya. I'll be talking about the continuous quality improvement and the budget for our business. So as you can see on the slide, this is a common framework that's been adapted for eye care and vision care. And so firstly, we would need to develop trustworthy clinical practice guidelines. And then next, those will be translated into practice. And then as a business, we'll be monitoring and analyzing the trends that we see from these outcomes. And then from there, identify gaps in care. And then the cycle repeats again, where we'll be developing better guidelines based off of the gaps that we found before. Another thing that could be useful is a patient satisfaction survey, and we'll be doing that to gauge the quality of our services. So it'll be on a scale of 1 to 5, 1 being poor and 5 being excellent. And we can also give our patients an incentive to complete the survey, like for example, a raffle gift card. I think another way to do this is to have monthly meetings, and these would be to discuss improvements that could be done for the business and to bring in more customers, increase patient satisfaction. It can also be a space where employees can bring up any issues or concerns that they have with the company. And so overall, we're always looking for ways to improve our business and provide quality eye services to everyone. So as you can see here, this is our budget. So this is a 5-year plan that accounts for various things. It accounts for the amount of rent for the space in Hawaii, and Hawaii is quite expensive, so that's why it's a main part of the budget here. So this would also account for the salary for our employees, the optometrist, the technicians, the managers, the opticians, etc. It would also be important to account for equipment, and we would be paying this per year. Another important thing is marketing, so we have a website, commercial, and brochures to hand out. So our total expenses will be increasing every year, as you can see in red, because we'll be hiring more people and increasing the salary of the people. So the profits are the last 3 rows on the bottom. So the first, about half of our profit comes from the reimbursement from insurance. So when we have a patient, we get half of that gets reimbursed from insurance, and so that's where some of our profits come from. There's also a profit from the glasses and lenses that we're putting as well. And then after the 25% tax is applied, the net income is a little more than $2 million. So from subtracting the green from the red, you can see that each year it looks like we're decreasing in profits. But I think it's important to note that even though it does look that way, it doesn't account for the increasing number of patients. So assuming that the marketing strategies are successful, we'll be having an increase in the number of new patients. And from our services, you can tell that our profits are going to be increasing. So theoretically, we'll be having an increase in profit every year. So some of the profits will be used to help donate because our mission is to donate 200 used pairs of glasses. So that would be what some of the profits would go to. And then the remaining can go to the owner, and it will be used to increase the salaries of the employees and potentially give them a raise. Thank you so much for listening to our presentation.